Hello and welcome to 72 Dragons Health. Welcome to this interview. It is an honor and a pleasure to have all of you with us today. Let me introduce our guest. Today we have the team associated with the storytelling series, What You Equal You Means to 4 Women of Color. These short videos portrays the interwoven stories of 4 women of color from diverse backgrounds, all along survivors of HIV, discussing what equal you, undetectable, equal untransmittable means to them. Each video demonstrates strength, power, resilience, and the importance of honest communication between providers and clients. We have the Primary Care Development Corporation and the New England AIDS Education and Training Center at the University of Massachusetts Medical School staff with us. Judy Lipshutz, Nancy Morisseau, and Vannessa Carson-Sasso. In addition, we also have the storytellers of the film, Michelle Lopez, Liza Pereira, Ivette Chavez Gonzalez, and Dawn Trotter. My name is Pietro Aparicio from 72 Dragons Health. Thank you for joining us and for sharing your experiences with us today. Without any further ado, let's begin. Judy, Nancy, and Vannessa, could you share about the film production, What You Equal You Means to 4 Women of Color, that was showcased at the American Public Health Association Film Festival 2023 in Atlanta, Georgia? What do you hope to achieve through this film?
I guess I could start. Thank you so much for having us. The film, You Equals You, What It Means to 4 Women of Color, the goal of the film was to educate providers and also others on what U equals U means, which we can explain, and also how important it is for healthcare providers to understand the lived experiences of people with HIV, and that this is such an important complement to educating providers and other people who work in the community about HIV beyond the clinical concepts of it. It's about that relationship and about the importance of reducing stigma. And we want to reach as many healthcare providers as possible with this important video.
Thank you. Vannessa?
I think Judy summed it up really well. And again, thank you for having us here today. But as an AIDS Education and Training Center program, we're a national organization, and our charge is providing training to healthcare professionals across the interprofessional healthcare team on all things related to HIV. And who better to hear about the impact of U equals U and how powerful that can be on people living with HIV than from the voices of lived experience. So to have these fabulous women, you know, in this role to really shout the message out, it was just amazing. And so that was our goal, and I think it was awesome. So thank you.
Thank you. And Nancy?
Yeah, the only thing I would add is that showing it at the American Public Health Association annual meeting during the short film festival, we were thinking it was an opportunity for us to get their stories out beyond the world of HIV care and treatment, because this really is a story that can be applied across the public health spectrum, regardless of what the issue is at hand. It's really about hearing from people with lived experience. And so we are really excited to be able to show the video at the annual meeting. Thank you.
Thank you for sharing. It's a great video, by the way. Now let me ask our storytellers, Michelle, Liza, Ivette, and Dawn. Could you explain the purpose of storytelling as an HIV prevention tool, and what motivated you to share your story with the world through the film What You Equal You Means to 4 Women of Color? If we can start with Michelle.
Yes, thank you so much. And again, thank you, Dr. Pietro, for having us. I choose storytelling. One, it gives us an opportunity, I see it, to connect in a non-traditional way with providers, and also to, if there are consumers like ourselves that gets a chance to view this, it's an engaging mechanism that I see today. Storytelling, it takes you to situations, circumstances, our lived experience, where you just would not get that in what I would call the traditional, sharing of our life stories. So storytelling for me, it's a nuance, but it's a mechanism that we see has been very effective in engaging both clinical and non-clinical individuals. And we have some great stories, so I'll let my other ladies share with you.
Lisa?
So, for me, I believe that using storytelling has a different impact, right? So my personal experience is that when I was first diagnosed HIV, I was introduced to somebody that also had HIV that was able to share their story with me, and it just made a different impact for me. So there was a connection there, as opposed to just having a conversation with a provider or a case manager, right? But to have someone come in and say, I too am living with HIV, and this is my life, and to really show me that I'm not going to die from this, and I can live a life like anybody else is important, right? And what motivated me to share my story was that for a long time, I call it suffering in silence. Like, I didn't want to, I picked and I choose who I told about my status. I knew that providers had to keep my secret. But, when I got into this field and I started coming out with my story, I just saw the impact it was having. And then when You Equals You came along, it was a game changer. It was a game changer for me, because it was like, oh my God, I can literally have relationships and not have that thought in the back of my mind that, number one, I'm tainted goods, and number two, I have the potential to hurt somebody and maybe kill somebody. Because that's literally what was in the back of my mind, right? Well, always in the forefront in the beginning. But You Equals You was a game changer. So I think it's important to use stories and continue to tell my story.
Thank you. Ivette, would you mind to share?
Good morning. My name is Ivette. So myself, storytelling is important. You Equals You, because people could identify as myself. I was a drug user, right? I've been in recovery. It helps identify for them, and they could, if they scared to say or talk about their story, we could bring them in so they could get tested. It opens a lot of doors, right, to the community to understand why are we in the front of these pages, right? Why we on billboards. So that's what opens up, is the importance of bringing in our community.
Thank you. Thank you for sharing. And Dawn?
I agree with everything that all the ladies are saying. Also, it just, for me, it's a way for people to identify with themselves. And when I say that, they can see a person that looks like them, right? They see me sharing my story, and they say, oh, it can happen to anybody. And it helps end some of the stigma of, oh, I can't tell when a person is HIV positive. You can be healthy. You can look like anybody else, right? So when I share my story, it's to give hope right? It's to try to end some of the stigma and also break down some of this discrimination that's happening. So I share my story to free myself, because once I became open and in front in the public on billboards, as Ivette says, I took my power back, right? No one had anything to hold over my head. And so for me getting my power back, I think it also gave others their power. So storytelling helps in, giving people power and trying to end the stigma.
Thank you so much for sharing. It's a very personal story, very powerful stories, and you must be very brave to be willing to share it with the world. So thank you very much. And if I can go back to some of the projects that the Primary Care Development Corporation and New England AIDS Education and Training Center are working. Can you share some of the projects that you are both involved in HIV prevention and care? And we can start with Nancy, if you don't mind.
Sure. So some of the projects that we're working on at Primary Care Development Corporation, PCDC, we're working on a health equity toolkit. And so that toolkit is some kind of a repository for clinical providers as well as social service providers to be able to access a lot of health equity tools. What we find in the field of HIV is that, we're often the leaders when it comes to health equity because of the way that HIV has been historically stigmatized and also currently in some ways still stigmatized. And so we thought that this health equity toolkit can help our providers, again, clinical or social service providers, to have kind of one place where they can go and find resources to provide equitable care, but also to help their agency kind of do an assessment and ensure that they are providing equitable care to their clients. So some examples are, we have been fortunate to work with the storytellers over several webinars addressing U equals U. And so we have those webinars available for folks. We also provide trainings and technical assistance. So if folks are in need of more targeted support, so whether that might be facilitating a workshop or providing them with very specific tailored tools to engage in health equity and HIV care and treatment, those are things that we're able to do. I'm gonna pass it to Judy. We have a lot of things, and so I know we're not gonna be able to get to all of them, but if there were additional projects that Judy wanted to highlight that we're doing at PCDC.
Thanks, Nancy. I just want to say overall that Primary Care Development, PCDC, was founded in 1993. It's a community development institution. And our purpose is to support healthy, thriving communities nationwide to expand primary care access and advance health equity in communities that need it most. The U equals U project is one project of the technical assistance and consulting that we provide at PCDC, funded by the Centers for Disease Control and Prevention. And as part of that work, for the past 10 years, we're actually in our 10th year of doing this work, we have been providing capacity building, basically on issues related to HIV testing, HIV treatment, for people who are positive. That's the focus of the work that we do. And we've worked with an array of organizations throughout the country. And then with the most recent grant, we are focused on the Northeast region of the United States. And one of the beauties of what we can do is we're able to provide customizable training and technical assistance based on the needs of a particular organization. And I would say this project has been one of the joys and highlights of all the work that we have done, that I have done personally over the past 10 years, because of what I have learned from these 4 women in front of us. or with us, because their vulnerability and intelligence and power and resilience and just urge and need to keep messaging about this important topic is the best work we've ever done. So I'll move it on to Vannessa.
Thank you.
Thank you, Judy. So powerful. So similar to PCDC, New England AIDS Education and Training Center is also part of a national network. So there's 8 of us across the country. Every state and territory has access to free HIV education and training through the AIDS Education and Training Center program. So here in New England, we cover the 6 states of New England. Similar again to PCDC, it is very much tailored to meet the needs of healthcare providers. So again, across the spectrum from peers and case managers up through prescribers on all things related to HIV. So from prevention across the HIV care continuum. So we offer, in-person, very targeted and tailored approaches, webinars, which we've collaborated with PCDC on over the years, which has been amazing. And so one unique project I would say that the AIDS Education and Training Centers have been working on over the last 5-ish years is practice transformation. So working with health centers to identify needs across prevention and the HIV care continuum, and really working with them to raise the bar. So whether it be HIV testing or PrEP or linkage to care, really using experts to go into the health center, working side by side with them to develop protocols and policies and really, raise those benchmarks up. So that's a longitudinal approach that we use, which has been fantastic. I mean, we've had clinics that didn't have a PrEP program, and we worked with them to implement PrEP. Another health center where they were testing for HIV but referring out for care, and now they're providing HIV care in-house, which is amazing. So it's my pleasure. The AETC programs have been around for over 35 years. I've been with the AETCs for 10 years, and I do, like Judy, want to just say that this project has probably been like the highlight of my career thus far, to work aside these women, and so I really look forward to hopefully other opportunities, but yeah, that's a little bit about us.
Wonderful. Thank you for sharing the amazing work that all of you are doing. So now let me go back to our storytellers, and if I can start with Dawn. How do you guys envision the potential of this film to impact HIV-related knowledge and reduce stigma? And some of you touched a bit on that, but if you could expand a bit and share it. Dawn?
I mean, for me, I hope that this video can be used for patients that are maybe newly diagnosed, right? And maybe specifically in their clinic, they don't have what we call a peer on staff, a person with lived experience. Maybe they can see this story and it will give them that, piece of relief that they may need to know that this isn't the end. Or even for new employees that come into clinics that are providing HIV care, they can see this video and maybe understand the language that we use, things like that. So just little things like that.
Thank you, Dawn. And Ivette?
Yes, the importance of this video is, I want to thank Judy, Vannessa, Nancy, and Pietro for allowing us to come and show a video, right? And speak about the awareness and the stigma that we having still in these hospitals, which is important, right? People like me, I used to be a drug user. I used to come to the hospital, and some people still today stigmatize me when I say I'm HIV positive, I'm undetectable. They're like, well, what that means? Now, being in the field, it gives you a different aspect because I could train, or I could, bring on, get tested. That's important to me, and to stop the stigmatizing of, we're still human beings. What I'm saying? At the end of the day, I like to carry the message. And so the peers who are coming after me feel comfortable and we could train them, and especially with the language, right? It's not AIDS no more, right? You know, because back in the day, you used to say AIDS, you used to think you're gonna die. Now it's not like that. Now I take a shot every 2 months and I'm okay.
All right. Thank you, Ivette. And Liza, would you mind to share with us, how do you see the potential of this film impacting HIV-related knowledge and particularly reducing stigma?
So initially, when I heard that this project was going to be used for providers, I was like so excited about that, and I really wanted to get on this project because, again, not am I someone who is living with HIV, but I also am someone who was an IV drug user. And as Ivette touched on, there's always been this certain way that I was given medical treatment because I was someone living with HIV, but also because I was someone that used drugs. And it's still happening. So I think it's important that we train our providers, and the message is getting out there that just because I'm someone with HIV, just because either I am or used to use drugs, does not warrant different treatment, right? So I should be treated medically the same as anyone else that walks in the door, whether it's primary care, dental, anything, that whatever service I'm going for, I should be treated just like everybody else. So I think it's important that we get that message out, because the fight is not really, we can get people treated, we can get people medicated, we can get people in the care. The problem is the providers and the pushback that's still out there, because I'm still experiencing that. So I think it's important to get that message out there.
Thank you, Liza. Michelle, would you mind to share?
Absolutely. I see the importance of this, again, film and what we have done. Really, really non-traditionally, again, being able to help providers with tools to engage individuals who are dealing, many of us are still having, and each of the ladies touched on this, the effect of stigma, discrimination, inequality in reference to our care. I'm a bisexual woman and I'm out, and I speak about my relationships. I'm in relationships, with individuals who are negative. So I am within this spectrum. Yes, I'm a big healthcare advocate, navigation care, but also too, I am, and I know HIV can be prevented 100%. For the gays, for the lesbians, for the bisexuals, for the transgenders, for everyone. And that's the impact that I see this having. It is show clinicians, right? Yes, a clinician, they play a very important role in our lives, but so do our lived experiences. And because we are showcasing our lived experiences, we are using this as a collaboration with providers, with clinicians, with members of the healthcare community. This is a different approach, and we are seeing successes already with our approach. So the work continues.
Yes, thank you. And thank you for sharing that and for focusing on primary care providers or healthcare providers. You would think they would know everything related to HIV/AIDS, but still there's a lot of education that needs to be provided to health providers. So let me ask Judy, Nancy, and Vannessa, the organizations you are working with, what are some of the future projects that you are contemplating, and is there any new film production on the horizon?
I'd like to say that we don't have current plans for future projects, but in filming, but we know that it's a priority and that we want to do it. We're very committed to the concept of storytelling, and we are more and more integrating storytelling into all the training work that we do. It's also become a component of the PCDC website to tell stories, because we know that it grabs people's attention. And when you sit in a room with, listening to a didactic training, whether it's virtually or in person, you need some way to grab you. And real life stories is what really gets people going and what absorbs them. So we do plan on having continuing projects on HIV as well as other issues at PCDC where we integrate storytelling. But overall, we're committed to whatever funding that we get in the future or continue. We are committed to health equity and to projects that advance health equity, technical assistance, and provider training in those realms. And for anyone that wants more information about that, they're welcome to look at our website at pcdc.org or to contact any one of us. Thank you. I don't know, Nancy, if you have anything to add to that.
Yeah, we don't have any storytelling projects on the horizon currently, but some projects that we are currently working on, where these projects are working with specific CBOs and health centers, but some things that we're looking on is helping folks improve their linkage to care rates. So like Judy said, we work in the Northeast region, but we also work within the territories of the U.S. Virgin Islands and Puerto Rico. We're also working with agency in New York City to improve their taking and also supporting their integration of additional support services to the care that they provide to their clients. PCDC offers a variety of trainings, workshops, opportunities for folks to improve their service delivery. So one other example is we're working with health departments. So we're working with the health department of the Virgin Islands to speak with heads of several agencies to help them get a better understanding of the impact of HIV on the island, but also to consider more specifically the impact of HIV amongst the LGBTQ plus population on the islands, and how those issues are interrelated in the sense that stigma against LGBTQ plus folks limits their desire and ability to engage in healthcare services. And so we really want to highlight that so that it's an island-wide effort to bring down new infections, and the goal is to get them down to zero. So that's just a little sampling of specific projects that we're working on. And we're honestly always looking for collaboration with other agencies. Vannessa knows whenever we come across something that we think would work, we're immediately going to her and saying, hey, is this something that we can work on together? Because we really do love the collaborative aspect of this project. And we really love the storytellers being able to put their stories out there in their own words, because it really is powerful, and it takes U equals U from this abstract concept to something that we can see people are living out. And Vannessa, I'll hand it over to you if there's something else you want to add.
Thank you, Nancy. So similar to PCDC, we are also federally funded. They're funded by CDC. We're funded by HRSA, Health Resources and Services Administration. And so we appreciate, like Nancy said, partnering and collaborating with our sister federally funded training centers to showcase excellent work like this one. And PCDC invited NEAETC to collaborate on this storytelling project, and my door is open for whenever they want to let me know. There's another opportunity for a storytelling project, because we're all in. But the AIDS Education and Training Centers, like I said before, we've been around for 35 years, well over 35 years, and we are going to be embarking on a new cycle effective July 1. So one new exciting thing that we're looking forward to doing is expanding our interprofessional health education programs. So we will be partnering with Yale University with their medical and nursing program. and several other health professions programs within the state of Connecticut to integrate HIV into their curricula. And the spirit of interprofessional work is taking, other disciplines and bringing them together to learn side by side. So we'll have medical, we'll have nursing, and then we haven't quite settled on the other disciplines, but it could be a mix of pharmacy, dental, behavioral health, paraprofessional, CHW. So we're yet to land exactly on all of the collaborations, but we're really excited to get the word out there, because it is very sad when you really understand the tiny bit of HIV education that health professions folks are getting in their educational career path. And HIV, as we have talked about, has really moved from the infectious disease realm to the primary care realm, and really needs to be treated just like any other chronic manageable disease, and normalizing and as these women have put it so beautifully, they're just living their lives. HIV is one part of their lives, and so we're just excited to help spread that word, because we need to cultivate a new workforce that is well poised to not only help prevent HIV with the many tools we have in the toolbox, but also then caring for folks. And as we know, folks, over 50% of people living with HIV are 50 plus and growing. They're living long and strong.
Yeah, thank you for sharing about all these very important projects that are so much of needed in our communities. So I want to thank everyone for sharing with us today. We really appreciate you sharing your stories with everyone. Your work toward HIV prevention and care is truly commendable.
Thank you for having us.
Thank you.
Thank you so much. Thank you.
Thank you.